Shruti, student of second year B Physiotherapy from Marwadi University. Today I will explain the cognitive behavioral therapy. Cognitive behavioral therapy is a form of psychotherapy. It is process of teaching, coaching and reinforcing the positive behavior. CBT helps people to identify cognitive pattern of thoughts and emotions that are linked with behavior. Medical use of CBT. CBT was originally designed to treatment of depression, but nowadays it is also useful in treatment of mood disorder, anxiety, personality disorder, eating disorder, addiction, dependency and psychotic disorder. Type of CBT. First type is brief CBT, a form of CBT which has been developed for situations in which there are time constraints on the therapy sessions. Brief CBT take place over a couple of sessions that can last up to 12 accumulated hours by design. Second is cognitive emotional behavioral therapy, a form of CBT which develops initially for individuals with eating disorder, but now used with range of problems like anxiety, depression, OCD and anger problems. It combines aspect of CBT and dialectical behavioral therapy and aim to improve understanding and tolerance of emotions. Third is structured cognitive behavioral training. It is assessed to challenge addictive behavior, particularly with substances such as tobacco, alcohol, and food. And it is also manage the diabetes and subdue stress and anxiety. Fourth one is moral recognition therapy, a type of CBT used to help felons overcome antisocial personality disorder. It is also slightly decrease the risk of further offending. Fifth is stress inclusion training. This type of therapy used a blind cognitive behavioral and some humanistic training technique to target the stressor of the clients. Clients means the patients. This usually used to help patients better cope with the stress or anxiety after a stressful event. Indications of the cognitive behavioral therapy: depression, eating disorder, personality disorder, sleep disorder, OCD, schizophrenia, anxiety disorder, bipolar disorder, substance abuse, sexual disorders. These are the some indications of the cognitive behavioral therapy. Technique of the cognitive behavioral therapy. The cognitive behavioral therapy technique are an interesting test of the exercise that help modifying a person's behavioral pattern. The behavioral patterns are modified in order of bringing about positive changes in a personality. First technique is cognitive rehearsal. In this technique, the patient is asked to recall a problematic situation in a past. The therapist and patient both work together to find out the solution for the problem or way in which difficult situation, if it occur in a future, can be sorted out. The therapist asks the patient recall the positive thoughts cognitively in order to make appropriate changes to later thought process. Power of imagination proves the greater use in such exercises. Second is validity testing. In this technique, therapists are check the validity of patient by briefs and thoughts. The patient is allowed to defend his viewpoint by means of objective evidence. The faulty nature or invalidity of brief of patient in exposed if he or she is unstable or produce any kind of objective evidence. Advantages of the cognitive behavioral therapy: teach the patient rational self counseling skill, emphasize getting better rather than they feel better. CBT creates long-term result since the cause of problem is corrected. Focus on patient's goals rather than the attempting to impose the therapist goals on the patients. Some disadvantages is also there in a cognitive behavioral therapy. A therapist is like a personal trainer. A therapist can advise and motivate the patient but cannot do behalf of the patient. Ineffective if patient is lack concentrated and unmotivated. It is time consuming therapy due to structured nature, not stable for the people with more complex mental health needs or learning difficulties. Thank you for watching. Have a good day.